Hi guys, it's Lex again. This is my outfit for my top surgery consultation that's happening at 2:15 today at Valley Plastic Surgery Clinic. I'm seeing Dr. Alice Saylor. I'm nervous but also like excited. I hope it goes well. I don't think I can film like during. I think it'd be really awkward to ask, like, I don't know, that's just like, yeah. But yeah, I will try film after about what happened and talk about like what we spoke about, and yeah, wish me luck. I'll see you guys later. Hi guys, it is much later. My consultation went really well. This video is going to be a bit everywhere because I have some clips at different times that I tried to film, but for some reason my camera quality was kind of bad and the audio might not be picked up on. But yeah, this video might be longer than my other two videos because I got a lot of information sheets from the clinic that I want to like go in depth. So yeah, also my family is back from vacation, so excuse the background noise. I'm trying to whisper because yeah, I'm not in the most safe environment, but hopefully the quality is still okay. Also, trigger warning and content warning for this video. I am talking about like top surgery, so if this is triggering or you know like surgery stuff just makes you uncomfortable, please don't watch this video. Watch my other videos that I've filmed. But yeah, if you stick around and this video helps you, that will make me really happy because I just want to help people and spread awareness on top surgery. Alright, so firstly I just want to say that the clinic was very freaking bougie. Like, yeah, it's right in front. There's like a bus stop. And it was so convenient. They have a lift and they have stairs, so if you're in a wheelchair or you have a disability of some sort and you have trouble with stairs for whatever reason, you can use the lift. And yeah, there was like some other people waiting in the clinic. A lot of the staff seemed female and a lot of the patients seemed female, which makes sense because I think they only do like breast surgeries, which makes sense. But yeah, I saw Dr. Alice Saylor. Has 15 years of experience. I think she told me that she's done like 1,000 top surgeries. And she's from far north Queensland. She gives me like weird Barbie energy, which I was not expecting at all. As I was saying, she gave me weird Barbie energy. If anyone's seen the Barbie movie, I feel like that's self-explanatory. Like, her energy was like really cool. She told me that she's like the black sheep of like the plastic surgery industry, which I respect. Okay, I guess I'll just start reading the sheets. So actually no, first I want to say that the actual appointment. So she basically just had like a bunch of pieces of paper, and she was like ticking stuff off and like asking me questions like about medical history, if I have pets, like jobs, all that stuff, just to like get an idea. She did make me lift my bra, but she didn't like touch or draw on my boobs or anything like that. It was just like a really quick, like, she just like had a look, and then she was like, okay, that's fine. And she saw me like bending a lot, and she was like, oh, like, yeah, like she can tell that I was trans from that, because we all do that. And she said that that's really bad in terms of like recovery, because like the surgery is, the aim is like to remove all the breasts and like for it to be flat. But if you like have bad posture during recovery, your body will naturally try to like grow the breasts again. So I was like, oh, okay, I gotta like try and sit up straight, so let me try to do that, because I it's such a habit for me. Okay, so firstly I'm gonna go over the top/chest surgery general information. Okay, so the aims of surgery in general: contouring of the chest wall and removal of breast tissue and excess skin, reduction and repositioning of the nipple areola complex, and to minimize the amount of scarring on the chest wall. Alright, techniques: different types of skin excision patterns depending on the amount of excess skin. These include periola, scar around the nipple areola complex, open approach with scar, ideally at the level of pectoralis major insertion, sometimes called a double incision. Open approach can be done with or without the replacement of the nipples as grafts. So I'm doing that. I still don't know if I want my nipples to be reattached. Dr. Saylor did tell me that the statistic is 70% of people that get their nipple grafts like done, they end up healing weird. So I'm a bit worried about that. She told me to look up images of like post-surgery results and see if like I'm okay with the average of those results. Or I can just get the like my nipples removed, and then I can just get nipples tattooed. So it's up to me. It doesn't change the cost. Doesn't affect anything really. It's just like my personal choice. And she said I have up until the day of surgery to decide, which is cool. And yeah, she told me that the pictures on their website have been removed for top surgery because apparently protesters have been harassing the clinic the past 4 weeks or something, and a journalist from the Australian is going after Dr. Saylor because she's the only surgeon in Queensland that performs top surgery on people that are from 13 to something, 13 up, but like there's informed consent and everything. They're just like against it. So I literally was like, bro, like I hope they don't like take you down because I really need this. And she was like, no, like they have like 4 federal laws to like fight against or something. I don't know. It's a disaster. I was like, I'm glad I'm not taking the journalism pass because that's another reason why I just dislike the industry. Okay, preparing for surgery. I'm crouching again. Stop smoking at least 3 months prior to surgery and be prepared to not smoke for 6 weeks post-operatively. Smoking increases the risk of complications. I do not smoke, so that's fine for me. It's important to be aware of all your out-of-pocket expenses and when these have to be paid. You will need a letter from a psychiatrist dated within 3 months of your date of surgery. This is really important. If you want the procedure to be considered as medical, you can get rebate from Medicare, and you can like save like $1,000, like $1,500 or so, which is really helpful. But the problem is getting a psychiatrist. So right now, my best bet is the Royal Brisbane Gender Clinic. I'm waiting to get a letter in the mail with information about that. Hopefully it comes. If it doesn't come within three weeks, I've got to call my GP practice and get them to like double check that they received it and all that, received the referral. Okay, day surgery is suitable for or overnight stay. This is preferable if you're covered with private health insurance. So I don't have private health insurance. I'm just doing this through like the public health system. So Dr. Saylor told me that I can do my surgery during the day, which means that I can get I would get sent home the same day. The operation takes up to 2 hours, which is pretty quick, which is cool. Yeah, it takes about 2 hours. Dressings over the wounds, drained one on each side, which I'm terrified for, and you get a compression garment. Okay, after surgery, so a course of antibiotics is routinely prescribed post-operatively. Chest surgery is usually described as uncomfortable but not painful. Regular Panadol with a stronger painkiller for breakthrough pain is usually all that is required for pain management. She told me that if you take too many painkillers, you will have like the worst constipation ever. Like she said, the amount of Maccas like on a road trip is not gonna be enough. She said it's like really bad, and if you have constipation, it's not good for healing. So it's better to take less painkillers than more. So I'm gonna keep that in mind. A compression garment is to be worn for 4 to 8 weeks, depending on the technique and natural physical characteristics. This is very ironic considering like most trans people bind, and like we're not gonna escape the binder until after quite a while. But yeah, that's also on the cost, which I will talk about at the end. Also, I know that this is a lot of information. I was very overwhelmed by the end of the appointment. But yeah, I just want to be as thorough as possible and like share this information. So drains are installed on each side. Yes, they are covered with a waterproof dressing. You will be asked to measure the drainage each day at the same time. You will be shown how to do this before you leave hospital. So with the drains, you are allowed to shower, but you can't like shower normally. Like you have to have a bird bath from the waist up, which is just like you just use like warm water and a cloth and like soap, and then for your underarms you just use baby wipes, and for the waist down I think you can like use actual water, but you have to clean your hair and like you have to stay clean after surgery. You'll be, oh yeah, I already said that. Okay, first post-operative visit. So this is like when you go back. So actually up to like a year, Dr. Saylor like wants you to come back in like regularly to check like how your healing is going and everything. She said she's very needy. And she told me that some surgeons actually like don't like, they want you to come back like even 5 years after, which to me is insane, but like at least they care. So first post-operative visit. It's usually 5 to 7 days after surgery. Drains are usually removed at this visit. Wounds cleaned and redressed. So she said, yeah, like around 5 days after you'll get your drains removed, and that's the only stitches that you'll need removed. The rest just like go away on their own. Second post-operative visit, usually a week later. If the nipples are grafted on, these will be redressed, tape removed, and the wounds cleaned. You will be given a roll of tape and shown how to apply it. So this is for like the tape that gets put on your scars, and she told me like to massage it to make sure that there's no like hard bumps. They'll like tell me about that like further down the process. And then subsequent follow-up. So further checks will be at 4 to 6 weeks following surgery. Swelling and shape change can take 2 to 3 months to settle. Visits at 3, 6, and 12 months. So this is what I said. Up to like 12 months. She needs you to like come in. And if you live interstate, these appointments can be done via Skype or phone, which is really cool. It just makes it more accessible. Okay, restrictions to daily activities. So no heavy lifting for 6 to 8 weeks. Including laundry, shopping, washing, heavy pots, etc. No driving for 7 days. 1 to 2 weeks off work, dependent upon your job. If there is heavy lifting involved, then no heavy lifting for up to 6 weeks. No gym for 8 weeks, up to 3 months. Scars. Suture are placed under the skin, although some may be placed superficially if the nipple is grafted. Sutures dissolve over the following 3 to 6 months. The scar length under and across the chest depends on the amount of chest tissue removed and the chest width. Everyone scars differently. Tape support or silicone gel for 3 months can reduce scarring problems. Factors affecting scar quality include infection, smoking, genetic, and racial predispositions. She did tell me that it's normal that there will be some like asymmetry, which is fine. And that like she'll do the best that she can, but it honestly just depends on genetics. Like that's literally, and like how well you take care of yourself, which does determine your results. Okay, complications. As with all surgery, smoking increases the risk of complications. I will not operate on anyone who has not been a non-smoker for a minimum of 3 months. Also, no nicotine replacements, vapes, or e-cigarettes. General complications may occur. These include, but are not limited to, infection and aesthetic complications. Okay, these are like some technical things. Deep vein thrombosis, pulmonary embolism, scar thickening, like which is also called keloid or hypertrophic, hematoma or seroma may require draining, and worm dehiscence. Specific complications of the operation include, but not limited to, nipple loss, position asymmetry, shape, nipple and skin numbness. She said it's normal, like you lose all like sensation in that area no matter what surgery you do, which is that's like the con of like having a flat chest, is you lose sensation in that area. Asymmetry of the chest scars and nipples, contour deformity of chest, fat necrosis, permanent and irreversible removal of breast tissue, and hence the inability to breastfeed, detection of breast cancer. So if they detect you have breast cancer, like after they remove them, the doctor will contact you and be like, hey, like you're cured, like congrats. But I asked like what happens after, like with all the breasts that get removed, and she just said that they just like burn it. Yeah. Okay, this is for revisions or like secondary surgeries, which I really do not want to have to do. Like the aim is just to like get it right on the first try, because that's just more money and like more time. So complications are rare provided you do not smoke, but can occasionally occur. There will be associated fees for revision or surgery. If you were insured, it may be possible to charge a known gap payment fee with your health fund and anesthetic costs. If you are uninsured, there will be out-of-pocket expenses for Dr. Taylor, as well as anesthetic costs and hospital fees. I will try to ensure that the fees will be kept to the minimum out-of-pocket expense. Thank you. Oh, okay, other considerations. All tissue removed is sent to pathology. Fancy. A mammogram or ultrasound may be required preoperatively if you were over 45 or not had one before. Oh yes, I haven't done that before, so I might need to pay for that. Anyways, cosmetic surgery can create improvements and help eliminate problems, but achieving perfection is unrealistic. Yeah. Right. That's the general information done. Okay, there's also a separate page for the risks of chest reconstruction, aka top surgery. A lot of them I have mentioned, but it says at the start, it says every operation has certain risks associated with it. Risks common to all surgery are addressed on the consent form and have been discussed. They are all unusual, although other less common complications can occur. So yes, informed consent. We're not trying to brainwash people into getting top surgery or forcing them to be trans, okay? There's informed consent here. I just want to let everyone know that this is all safe. It is done by professionals. There is informed consent, and the surgeon makes a pact with you that, like, no matter what, you ask questions. Like, never, like, leave, like, the clinic feeling confused, like, not knowing what's going on. Okay, last bit about this is most important, in a way, is the fees. Alright, so this is an estimate, okay? I have calculated it, but I'm just gonna read, like, the individual costs and then tell you, like, how much it actually costs, approximately. So as a service to our patients, we provide the following estimate of the likely medical costs you will be required to pay for your in-hospital or day surgery elective procedure. Please note that we are only able to accurately quote for the fees charged by this practice. Our surgeon's fee does not cover services provided by other doctors such as anesthetics, radiologists, or pathologists, or the costs associated with the stay in the hospital or day surgery unit, such as accommodation, pharmacy, or physiotherapy, which will be a separate cost. As with any medical procedure, if unforeseen circumstances should arise during your treatment duration, it may be necessary to arrange additional medical services or use a different or more costly prosthetic device. If this happens, there may be additional costs to you that are not covered by this estimate. If you have any questions, please do not hesitate to contact our rooms to discuss these costs before your procedure to be sure you understand what costs you may be liable to pay yourself. You will be liable for any costs not covered by Medicare or your private health fund. Okay, so the name of the procedure that I am getting is approach with grafts. So this is bilateral subcutaneous mastectomy, open approach with grafts. Oh, sorry, I said that wrong, but yeah, that's the full name. So the surgeon's fee without the Medicare rebate is $8,500. The rebate is $1,350. So that gives you an estimated patient gap. So what you actually will end up paying is $7,150. This is if you get a psychiatrist referral to diagnose you with gender dysphoria within 3 months of your operation. Okay. Other services. Upon booking, contact details for the additional service providers will be provided for you to obtain accurate estimate of fees directly from their rooms. The below fees are provided as service to you of the likely overall fee for the procedure. Fees are subject to change. We cannot guarantee these fees are full and final. So potential extra procedures. So unforeseen complications may arise due to the nature of your surgery requiring further medical or inpatient care. Dr. Saylor would ever discuss these with you at your consultation. If you would like further information or quotations, please ask the reception staff. So the anesthetist. So upfront fee is $2,200 approximately. Dependent upon the anesthetist, I can't say it. Rebates available. Oh, I didn't know that. The anesthetic fee range provided is an approximate only. Once a surgical date is secured, you will be provided with contact details of the anesthesist in order to secure definitive aesthetic services costing should you wish to contact them to confirm. So if you have private health insurance, or if you want to stay in the hospital like overnight, there are 3 different hospitals: the Brisbane Private Hospital, Pacific Day Surgery, and Houston Private Hospital. Now, Dr. Saylor only does the bottom 2, so Pacific Day Surgery. So theatre and day case fee is approximately $3,118, or the Houston Private Hospital, which the fee is $3,000 approximately. Please note the fees above are an estimation only. Once a surgical booking has been made, more definitive hospital fees will be provided. I am not doing that, just because that is an extra $2,000. I'd rather not. Now, pathology and radiology, if required, will be approximately no more than $600 out of pocket. Now, garments which you need to get. So you get 2 post-operative support garments. This is $310 for both of them. Okay. Oh yeah. I need to calculate. Yeah. Let me tell you the cost. I'll be back. Okay, I'm back. Okay, the cost without the pathology and radiology thing is around $9,660. With the Medicare rebate, which is pretty good. Like, it's under 10K. I heard from friends that it was like more than that, but I guess it depends like on things. Hopefully I don't have to get revisions done, and I don't have to get like extra tests done. But if they need to do that for whatever reason, like, I'm obviously like gonna like abide by what they say. But yeah, that's the rough cost. And yeah, the next visit is like, I don't have to pay extra. It's included in the consultation fee, which, by the way, I paid like $275, but the rebate is around $40, so I ended up paying around like $200 for the consultation. But for the next appointment, we're doing like the binder fittings, and they're gonna take pictures of my chest if I want to, for like before and after pictures, and I can keep asking questions. And yeah, they did say that they can book me in December, which is pretty good, like end of the year. But I said that I would wait just to like sort out the psychiatrist appointment thing, because like I need to figure that out before. And yeah, also I forgot to mention, but being on testosterone doesn't affect the surgery at all. She doesn't care about whether you're on T, like if you're on hormones, if you're gonna start hormones. She said it doesn't matter. The only thing is that if you go on testosterone, like if you're on testosterone, your scars will be red, might be red for longer, like after the procedure, which is fine, like it will go away with time. But yeah, that's the only thing, and I think I've covered pretty much everything in as much detail as I could. I'm sorry if this is a lot of information, but I just wanted to like, let you guys know on what I know right now, because it's a lot to process. I can't believe that this is actually happening. But yeah, hopefully I can get it done like in the next year. Also, and yeah, I'll talk to you guys next time in my next video. Please like, comment if you want to, subscribe if you like the content that I make, and yeah, thank you for watching. Peace.